Endometriosis is a very painful problem. This happens when the lining of the uterus, which is called endometrium, is carried by the backward flow of the menstrual blood, and instead of flowing out of the body, is carried through the uterus, through the tubes on the either side of the uterus, into the abdominal cavity, and collects in areas around the uterus. Now, this blood has nowhere to go, so it gets organized, gets clotted, and becomes sticky, and over a period of time gets larger and larger until it sticks to all the intestines and other organs around the uterus and can ultimately form a big frozen mass. Now, how does one recognize endometriosis? One of the most common complaints you may have if you have endometriosis is pain during the periods, and typically this pain lasts throughout the cycle, and commonly even after the menstrual cycle. You can possibly have pain during intercourse. You might have problems conceiving a child or problems during movement of bowels. How do you diagnose endometriosis? Now, ultrasound does not always diagnose endometriosis, because for ultrasound to diagnose endometriosis, there has to be a reasonably sized collection, larger size collection of this blood, and this typically occurs when it happens in the ovaries, which is called the chocolate cyst. Laparoscopy is a mainstay of diagnosis of endometriosis, and it's important one is very sure that one is dealing with endometriosis, because, as I explained, if you have endometriosis, you will require a form of treatment. Remember, endometriosis is a chronic problem. It can keep coming back. So, before starting with any treatment, one needs to be very sure what one is dealing with. Now, treatment can be of two types. Conservative, if there is a younger girl or younger lady with no family, of course, you are not going to do a very major surgery. You will try to clear out the blood clots in and around the ovaries, around the uterus. Maybe if there is a cyst, and prescribe a treatment of a period of at least 6 months. These are available as tablets or injections, and they create a state called pseudomenopause or false menopause. And because it causes this false menopausal state, we cannot prolong the treatment for long. But even after 6 months, you might remain symptom-free for a period of time. One cannot give exact guarantees. The endometriosis can always come back as long as the ovaries are there. Unfortunately, although it is not a malignant condition, it really has a bad habit of coming back again and again. And the only definitive form of treatment is surgery. Removal of the ovaries, which of course includes the uterus, because there's no point keeping the uterus if you don't have the ovaries. As long as the ovaries continues to produce hormones, and if you have a predisposition to have endometriosis, there is always a fear that any backward blood flow can lead to endometriosis. And at an older age, or if the endometriosis is very severe, unfortunately, you might require to remove both the ovaries and the tubes. Thank you.